What we know is that diet and lifestyle can reverse diabetes, and there's increasing evidence on this. There was a narrative review that came out just a couple years ago looking at the highlights of what people can do to be able to reverse diabetes. And it's the standard things that you would think about. The first one is, adopting a more active lifestyle and moving as much as you can, doing weights, doing more walking. And then sort of going from being sedentary to more vigorous, more socialization. But when you socialize, to socialize in different ways, not just to go to someone's house and have a fabulous meal, but take a walk together or do something active together. The third thing, of course, are things that have the focus on foods that have more complex carbohydrates or have much less carbohydrates, intermittent fasting. So there's a lot of different types of things that we can do, but reaching out and forming a community, having a community group, people who can support you, all of those things make a huge difference. And because we often live in large embedded communities and multi-generational families, we can't just do it on our own. We have to do it as a community and do it as a family unit. Okay, so there's a lot of behavioral change models that you can think about that we can use, some things like the BJ Fogg model from Stanford, which looks at sort of the, behavior and motivation ability, and then, how hard is it to do, how easy is it to do, how high is your motivation, how can you reduce the threshold for action, or stages of change, which is a very well-known model of, kind of getting ready to do something, doing it, maintaining it, preventing relapse, and then kind of going back to the point where you're just kind of thinking about it. So these are very standard models that people think about, but rather than think about behavioral change models, we're going to transition to something that I think is even more powerful, because I think that the data tells a very clear story.